Hello, Dr. Day here from Steinway Family Dental Center. We get a lot of questions about orthodontics, so today we're going to answer some of the most common questions we got so far. What is orthodontics and how does it help to improve dental alignment? Orthodontics is the direction of dentistry that helps move teeth into the correct position so they stand in the right place and they occlude or touch, meet with the opposing arch teeth at the right proportion. What are the different types of orthodontic treatment available today? Everybody knows about braces, and that is the most common, the most well-known thing, and that's one way of putting the wire and braces that are attached, the brackets attached to the teeth, and they move the teeth and put them in a certain position. A newer way of moving teeth that is called with the clear alignment therapy. It could be aligners like Invisalign, which is the most common name for it. There are other companies that use the same thing, like clear alignments of plastic that sits over the teeth, hugs the tooth and shifts it to a certain position. That is the two ways of moving teeth. There is also a surgical way to move teeth, but that is a little bit more painful, a little more involved. Usually not done by a general dentist, it would be done by an oral surgeon, an orthodontist, or a combination of both. At what age should the patient seek orthodontic evaluation? Well, it should be at the time when the child is getting the mixed dentition, when they have some children's teeth and some adult teeth, and the condition could be predicted and prevented. There are some things available that is a combination of plastic and maybe some wires to help the teeth fall into the right place. Basically, there is a procedure called early start. That is when they start treating children earlier, meaning that they just 6, 7, 8 years old, 9 years old, and that's when they start moving teeth and help them grow into correct position rather than correcting them later on. And then, of course, it's followed up with some clear alignment or braces to finish it off. How is orthodontic treatment different for teens versus adults? Well, of course, teens are not as compliant as adults. Invisalign, right, is a clear plastic and they may just take it off and not wear it. So that will not help the treatment to be done faster. This is why the braces would be the choice for non-compliant children, because now they give that control to the doctor. They cannot remove braces by themselves, and therefore they're going to be wearing, or they will be forced to wear it. So they're going to be more compliant with the treatment and they will get the results that are desired. For adults, it's different because adults are more compliant, so Invisalign would be the choice of treatment for them because it is faster, it's easier, it's not as painful, and the results you can get a lot faster than with braces. Braces versus clear alignment. What are the cost differences between the cost for it is about the same. So the only difference is the time that the treatment takes, and if you having a payment plan, and usually orthodontists do that, they will charge you some fee and then they will charge you monthly, and that takes 2 to 3 years to finish the treatment. Then they can spread the payments for 2 to 3 years. Today there are different payment plans available from the third party or some banks that will give you interest-free financing for the whole thing, so you can finish your treatment and continue paying for it if that's what you require based on how much a month you can afford. So I would say the faster the treatment, the better it is, the faster the results that you're going to get that you want, and payment is just a separate issue, and you can still spread your payments over the long period of time if that's what's better for you. What should patient consider when choosing the best orthodontic provider? I would say convenience. Is it convenient for you where the location is? How often do you have to go and see the doctor? Is the doctor available when you're available? And the main thing is, can the doctor provide you the results that you would like? You have to get along really well with your doctor, because you're going to be seeing that doctor for a short period or long period of time, but you're going to be seeing them more than once. So it would help if you actually have a good relationship with them. How do advanced orthodontic techniques improve outcomes? If we looking at the differences between regular braces and clear alignment, it's the same difference as in between a telephone in the last century that you would have to be plugged into a wall and you have to be connected to it, right? So you can talk on the phone only, versus today everybody has their device at the palm of their hands and you can even watch videos on it and you don't have to be plugged into the wall. So the same thing is the difference between braces and clear alignment. The clear alignment are a lot more controlled, so therefore the prediction could happen before you start the treatment when it's going to end and at any given time where you're going to be in the course of the treatment. With braces it's slightly different because it would require orthodontist tweaking your treatment every step of the way. So pretty much almost every month the orthodontist will tweak your treatment. And you would see results more clear in Invisalign because you can visualize everything on the computer screen in the simulation before you start. There are techniques when we have, for example, procedure called propel, that we can propel your treatment into moving faster. And instead of going to see your orthodontist every 4 to 8 weeks when they have to tighten up your wires and therefore it would move just as much and as safe without putting as much pressure, because clear alignment put about 50% less pressure on your teeth, but because there's no wasted movement, the movement is actually faster. So those are the questions that we got so far. You can actually call us and schedule an appointment with me or one of our doctors here at Steinway Family Dental Center. You can call 718-728-3314 or just online on alldentalneeds.com and request an appointment, and one of our team members will contact you and schedule you to come in and I will answer your questions.